Good morning, everyone. Today we'll talk about measuring the patient outcome. How can we measure the patient outcome? We need to conduct survey. So how can we conduct the survey? To measure the patient outcome and patient satisfaction. So today we'll talk about two models. Structure process outcome model. The other model is ECHO model. It's economic, clinical, humanistic outcome model. Also, we try to describe the four concepts of the patient satisfaction. We'll determine the patient-centered care and promoting patient satisfaction, less factors that contribute to patient satisfaction. And finally, we need to construct items or instruments. We call them survey instruments or survey items. The questions, we call them items or instruments for the survey, okay? Before go to this one, we need to know why we care about patient satisfaction. Why we care as pharmacists about patient satisfaction. Because we need feedback from the patients. If we did well, that means our job is good. But if we didn't do well, we need to improve our practice. So we need to shorten the waiting time, we need to improve patient waiting time, we need to improve patient safety, reduce adverse drug reactions, because all the world care about the patient satisfaction because it's business, especially in private business. We care about the patient satisfaction because we need this patient to come back again to ours. It's business. If we lose this patient, we will lose the one customer. So it's important we take care of these patients. The patient at the end of the visits will be satisfied. Okay? Let's put this in systematic way. When I say systematic way, we need to know if we did something wrong for the patients. We need to identify where's the problem because we need to fix it. How can we identify the problem? We need to let's see this system, which is structure process outcome system or model. It's created by Donna Bedian. This simply we have structure. We have structure mean resources. Like if I have my own pharmacy, what do we have in the structure? I will have my building, I have my shelves, I will have my medications. All these resources are the structure, okay? The process here, anything I conducted within my pharmacy, such as dispensing, counseling, educations, communications, this is the process, okay? Outcome, it's either my pharmacy outcomes, how much I get per month, and how is my patients doing? So outcome could be patient outcome, could be my organization outcome. So for every business, for every organization, there is structure, such as hospital, buildings, beds, process, patient communications, patient cares, okay? And we have outcomes. Outcomes, either patient outcome either clinical or economics or humanistics, or our organization outcome. So imagine you need to learn there is a system always. Like if my pharmacy income is not good and my patient satisfaction is not good, I need to look back to my structure. Is it a problem in my pharmacy building? Do I have enough space for the patient to sit? Do I have air conditioning? Do I have good lighting? Do I have organized, clean shelves? I need to improve my structure. If the problem is not in the structure, I need to go back to the process. What about my communications with the patients? Do I communicate well? What about my behavior, my welcoming? If I have perfect pharmacy, but I'm a rude person, I'm not doing good communication with the person, so I will lose at the end of the day, I will lose my patient satisfaction. So both structure and process are important to improve the patient's outcome and my business outcome. Keep in mind, those are related together. So as I mentioned, structure is anything like pharmacy computer, softwares, robot system, process, anything like medication counseling. Outcome could be patient outcome, which is in ECHO model. We'll talk about the ECHO model. in these lectures. So we need, if we have problem, as I mentioned, we need to fix the structure or fix the process to improve the outcome. Let's take a look here. This diagram is combination of both structure, process, outcome. Okay? It's Donabedian structure process, but we have another structure. We have another model within this model. We call it ECHO model. Have you heard about ECHO model? ECHO model, E stands for what? Economics. C for clinical. H for humanistic. O for outcome. Okay? Clinical, how can we measure the clinical outcome for the patients? Would you give me an example about clinical outcomes?
Quality of life.
Clinical outcome.
Lab results.
Lab results, vital signs, blood pressures, blood glucose. We can measure our clinical outcome by measuring blood glucose, blood pressure, vital signs. How can we measure the economic outcome?
Patients re-entering the...
How much we spend for this admission?
Recommend visits by the patient.
How much would this patient spend for hospitalization? It's economic, it's related to the cost. How can we measure?
If it's expensive, we will not return.
So this is economic, it's related to the price, related to the cost. What about the humanistic outcome?
Quality of life.
Quality of life, it's one of the humanistic outcomes, such as how long I can walk, how many stairs I can climb, how many miles I can walk. Can I do my daily activity? Do I have muscle pain so I cannot go to work? So it's my quality of life. It's important. So keep in mind, we care about the clinical outcome, we care about humanistic outcome, we care about the economic outcome. What's your question?
What psychological outcomes? It's already included in the humanistic or?
Psychological, if it's mentally, yes. But if it's psychological, like it's clinical, it's maybe related to clinical. It depends on the, what do you mean, if it's disease related, it could be clinical. So, ECHO model, it's economic, clinical, humanistic. Let's talk about economic cost. We have three types of cost. We have direct cost, we have indirect cost, we have intangible cost. Could you give me an example about direct cost?
The price of medication.
Price of medications. So direct cost, price for medication, price for the physician visit, price for the lab data, all these direct, I should pay directly. Could you give me an example about direct non-medical expenses? Direct, non-medical.
So this is transportation to the...
Transportations. If you live in different province, you need to pay for transportation. You need to pay for the hotel. You need to pay for the lunch. You need to pay for the companion. You need, this is indirect, direct non-medical. While for physician, pharmacist, medications, those direct medical, we have direct non-medical. Could you give me an example about indirect cost?
Days of the work.
Days out of the work. Lose of productivity. For example, if we have construction worker, and this construction worker's payment like 25 Iraqi dinars per day. If this man misses his work for day, he will lose 25,000 Iraqi dinar. Imagine if this person stay in the bed for 3 days, how much will lose? We'll lose 75,000 Iraqi dinars, or stay 3 days in the hospital. So this is lose of productivity. This is indirect cost. What about intangible cost?
So maybe, for example, the side effect that may really happen in the future.
Intangible cost, something I feel affect my quality of life. Like for example, of intangible cost from statins, which is muscle pain. This is intangible. It's hard to measure it. It's hard to detect it. You cannot put money on it, but I feel muscle pain because I'm taking statin. Okay. So in the US, this is the direct cost for the hypertension. This is indirect cost for the hypertension. And look to the direct cost is prescriptions, physician visits, hospital care, nursing home, home health care. Those are direct, okay? When I say direct, doesn't mean you pay from your pocket. There's difference between direct and you paying from. In Iraq, we don't have health insurance system. We have either public free or private sector, which is out of pocket. In the United States, they have private insurance and they have public insurance. For the elderly above 65, they have elderly, they have federal insurance. The government pay for their insurance. But for the other, like 50% of people, they have private insurance. Like if you are a faculty member in a college, there's private insurance. Private insurance, there is third party. You pay for this private insurance $200 per month. And this private insurance will cover all your visits. But you need to pay something called co-insurance, co-payment. You need to
investment.
Yes, investment. So you don't have to pay out of the pocket. But in Iraq, we only have out of the pocket. We don't have third party. We don't have private insurance, unless I think Al-Kafil Hospital, I heard, in Najaf, they have private insurance now. Dr. Mohammed Rikabi mentioned this to me. They started working in insurance. But still, indirect cost. How many days this patient missed from the work? And it's easy. We need to multiply how many days this patient missed, multiply by how much per day the income. So if they miss 3 days, 225,000 Iraqi dinars per day, we end up with 75,000 Iraqi dinars as indirect cost. So if we need to measure the cost, we need to measure the direct and indirect. When I mention indirect cost, it's really important in the Iraqi Ministry of Health, when we choose the medication, especially in Iraq, we have the higher board, which is medication board selection, which is similar to FDA in the US, responsible for, we need to do cost effectiveness analysis and cost benefit analysis, because we need, if we have two medications, one of them given once a month, like for example arthrobiotin or another, something like that, and the other medication given 4 times a month, you need to calculate the indirect cost. Indirect cost for the patients, like you need to measure the transportation, you need to measure also what about my staff, because my staff will spend 1 hour weekly, like 4 hours a month for this medication, while my medical staff will spend 1 hour take care of the other medication. So we need to measure the indirect cost. You need to keep in mind the frequency of the visits, the staff time. We usually care about how much this costs, and we only measure the direct cost, which is not accurate. We need always to look indirect cost and also direct non-medical cost, because this patient will pay for transportation, will lose 4 days a month to come to the hospital. Imagine, you need to, when we measure, when we compare those cost effectiveness analysis, we need to mention how many times this and how many times this medications. So ACO model, as I mentioned, now we care about C, which is the clinical outcome. Clinical outcomes, you give me example about blood pressure for hypertension. We need, how can I measure the outcome for diabetes, HbA1c, or blood glucose? How can I measure the outcome for asthmatic patients? Expiratory volume, forced expiratory volume. So we have measures for each disease to measure the clinical outcome, okay? How can I know this statin is working? I need to measure some proxy measure, which is blood lipid profile, okay? This is a clinical outcome. Also, clinical outcome could be something different. It's not direct measure. It could be frequency of hospitalizations. How many times this patient hospitalized per year. If it's on this medication, it's hospitalized 5 times. If it's on this medication, hospitalized 3 times. Which one is better? Less hospitalization, always better. It's always, because you know hospitalization affect quality of life, affect the cost, okay? So always, number of hospitalization is one important measure for the outcome. And I just attended lecture for Dr. Salam talking about the medication therapy management, try to reduce the number of hospital admissions, because I care about hospital admissions. When I discharge patient from the hospital, I need this patient not come to the hospital in the next month. They call it 30 days hospital readmissions. And you know there is punishment in the United States if these patients come back within 30 days. Punishment for the hospital. If your hospital discharges patients and this patient readmitted within 30 days of your discharge, the government, they will not pay you the money. You need to responsible for paying all the expenses for this patient because it's your fault. You didn't do good job. You didn't do medication safety, reconciliation. You didn't do good counseling. This patient is not stable enough, and you discharge it. So, a 30-day readmission is one of the clinical outcome measure. We have also other measures for clinical. We have not effectiveness only. We have, as we mentioned, adverse drug events. And you know, what do we mean by adverse drug events? It's medication-induced harm. Any adverse drug events, any injury. So it's not only we care about blood pressure, we care about the adverse drug events. We don't need this patient experience bleeding from warfarin. Warfarin is very effective to prevent cerebrovascular accident after atrial fibrillations, or after MI, but we need to care about the bleeding. So clinical outcome is really both effectiveness and adverse drug reactions or adverse drug events. Keep in mind there is H, always H. What do you mean by H? Humanistic outcome. It's the quality of life. Because when I go to home, like in the United States when I had my surgery, after the surgery, I visited my doctor, and before the physician time, they give me a small survey. They say, what do you feel? Do you feel now better before the surgery? Can you walk now better, longer distance? Can you do your physical exercise? And there is always scale from 1 to 10. So they care about your humanistic outcome, because why I did my surgery? Because I needed to walk. It's my quality of life, because I had knee pain. I couldn't walk before the surgery. I couldn't do exercise. Now after the surgery, the target of surgery is to improve my quality of life. I should able to walk. I should able to do my physical exercise. I should able to go to my work. So it's humanistic outcome. It's hard to measure it, but it's what that why we call it intangible cost. Any pain, we call it intangible cost. How can we measure the quality of life? There is very common measure, which is at short version, at short form 36. We call it SF36. This SF36 measures the physical health and the mental health. We care about, as you know, the definition for the health by the WHO. Do you know what the definition is for the health? It's not only you are physically healthy. You need to physically healthy, mentally healthy, socially healthy. So I should be physically healthy, mentally healthy, and socially healthy. Socially, such as I need to communicate with my friends. I need to communicate with my family. This is socially. So it's not only absence of physical pain or physical disease, should be absence of physical, mental, and social diseases. This is the definition of WHO in 40s for the health. We care about physical health, we care about mental health. So we call these scales. Each one of those are domains. Big ones, we call them domains. We call those scales, like multiple questions, they measure the same thing. All these questions measure the physical functioning, like the bath, dress, walk 1 block, walk several blocks. All these questions, they measure one single thing. Keep in mind, this we call those scale. Measure the physical functioning. All the general health, all these measure the general health. We care about the raw physical. We care about body pain. For the mental health, we care about vitality, social functioning, mental health, and all functions. These are questions to measure quality of life, okay? As pharmacists.
quality of life and measuring.
Measure.
Brief structure سؤال.
Yes, there's always short version of this. There is another version called SF12. Good question. There's shorter one. SF12, they reduce the number of questions. Okay? Pharmacy and satisfactions. Why we care about satisfaction? Why we need our patient to be satisfied? It's business. We are running business. It's our pharmacy. If we don't have loyal patients or customers, they will not come back to us again. We need this patient to come again. So we care about what? Care patient satisfaction. We need this patient satisfied. Okay, feel good after the visit. So, as you can see here, this is just joke. Say, we hope you enjoyed your stay. Please tell us about the survey. And when I took my daughter to the hospital after a couple of days, they mailed me a survey. They say, please fill this satisfaction survey. So hospitals cares about satisfaction. They judge by the satisfaction. So what do we mean by quality? Is extent to which program and service increase likelihood of desired patient outcome and decrease undesired outcome. Quality, if we have higher quality, we have better outcome. If we have lower quality, we have lower outcome. Okay, lower outcome like patient outcome. I'm talking about the patient outcome. So we care about the patient satisfaction. We care about the patient quality of life. Let's talk about the patient satisfaction. How can we measure the patient satisfaction? We need to ask them questions. How can we ask the patient questions? We have several ways to measure, to send this survey. So let's talk about the pharmacy structure process outcome. So in the pharmacy, ideally, what do we have in the pharmacy as structure? Building, medications, shelf. What do we have in the process? Dispensing, counseling, communications. What about the outcome?
Patient satisfaction.
Patient satisfaction, it's one of the outcomes. Clinical outcome and the economical outcome from our point of view as pharmacists and from patient point of view.
Compliance of patient to medication. Adherence of patient to medication.
Adherence of patient to medications. Type of satisfaction evaluations. We have 4 concepts or 4 domains to measure the patient satisfactions. The first one called performance evaluation. We need to ask the patient, how did we do about our service, our performance, okay? So we always need to ask about the performance. Always need to ask about the performance. This is the first one. We always also need to ask about this confirmational of expectation. Usually we have, the patients come to the pharmacy or comes to the hospital with expectations. I will spend 10 minutes in this pharmacy, okay? There's expectations. They have expectation. This medication will cost me $50 or whatever. So, did we meet the patient's expectation? This is another story. Effect-based evaluation, which is related to the mood of the patients. For example, if this patient leaves with smiling, feeling better, enjoy the service. This is the feeling, okay? I'm thankful to you, okay? It's really great service. I will come back again. Equity-based evaluation. Also, we'll talk about this. In every survey, we call it survey. Sometimes they call it questionnaires. We usually use a scale. When I say scale, it's 1 to 10, for example. We put points. Like, for example, 1, the worst service ever. 10, it's the best service ever. Okay? We always ask questions about, as you can see here in these small pictures. We have the 1 represents upset, 2 is better. So always if you put your questions, you need to start with the worst toward the better, toward the best. Exactly. So you need to always ask the patients, non-satisfied, very strongly non-satisfied, non-satisfied, neutral, satisfied, very satisfied. Look to the question, or strongly disagree, disagree, neutral, agree, strongly agree. Don't start with a good response, because we need to give small number to the worst condition. So for the performance evaluation, for example, usually you have two types of to form the items. When I say items, I mean questions for the survey. You have two options. Either you ask questions and give answers, or I prefer you put a statement. And you put a statement, and you put choices for this patient. For example, this service is convenient for me to use. This is for the patients, and you give them 5 choices: strongly disagree, disagree, neutral, agree, strongly agree. Can you see this difference? So at the end, we will see extremely unsatisfied, unsatisfied, neutral, satisfied, extremely satisfied. We have this service can be relied on to meet my need. This is performance evaluations. And if the patient chooses the low one, we put low score. Like if you need to measure this, you need to put 1, 2, 3, 4, 5. Okay, this is the way to measure the survey. The second way, or second concept or domain for the survey of patient satisfaction, we need to measure this confirmation of expectation. The patients come to the pharmacy with expectations. They have expectation of how much they need to pay, how long they will stay or wait, okay? If we meet their expectations, they will be satisfied. Otherwise, they will be unsatisfied. So they have expectations and they receive the service. So the perceived performance compared with the expectations, if we have this confirmation, we end up with low satisfactions. We need to meet the expectation. Okay? We have 2 types of these confirmations, either positive or negative. We need a positive. Either we need positive this confirmation, or we satisfy them. Okay? Keep in mind those questions. We usually send so many questions, so many surveys, but there is something behind the survey. We need to measure something. In your survey, you need to measure something, and your question should measure. For example, why I'm asking this patients this questions. The quality of this service exceeded my expectation. The service I received didn't live up to my standards. Those questions are not related to the performance. Those are related to the expectations. So the answer for these questions measure what? Measure the expectations. So we have 2 different domains. We have performance, we have expectation. Each questions answer something different. We don't mix up the questions. Don't put 2 questions in one item. Like for example, you cannot say, the quality of this service exceeded my expectations and it's best quality ever. Don't ask about 2 things in one question. This is called double barrel. Like for example, this service is good and cheap. You cannot ask this question. Why? Because if this patient is giving you answer, you don't know the answer is related to the quality or to the cost. Choose 1 questions per each thing. Don't ask 2 questions or 2 things in 1 question. This is maybe very common mistake. And you say, I need to reduce the number of questions. I will ask 3 in 1 or 2 in 1. This is the very common mistake we do. We have effect-based evaluation. Measure the emotional response to the service. ليش واحد من يطلع من الصيدلية يقول له رحم الله والديك؟ بالعراق معناه هذا كلش قد لعد احنا مسوي له زين، بحيث يقول رحم الله والديك وكلش ممنون واشكرك. شو تعبر؟ عبر على effect-based evaluations. Okay? I'm pleased with this service. I'm thankful for this service. We ask about the emotion. This patient may not, this medication may not affect the patient blood pressure. But we talk with the patient in a way, at the end of the visit, this patient is very thankful. So it's really different than the clinical outcome. It's something we did in our behavior, in our communications. Finally, equity-based evaluation. There is always, we have previous experience. I visited Dr. X. Now I'm visiting Dr. B. Okay? I have experience with Dr. X. They charged me 25,000 Iraqi dinar, and I waited 2 hours. Okay? And I had this experience after the visit. In your visit, if you treat me, if you take the same amount of money, the same amount of time, but you treat me better, so I'll have better experience. If you treat me with the same outcome, with the same waiting time, but with cheaper cost, I may be better satisfied. So we always compare our previous experience with the current experience. This patient already visits so many pharmacies before visits your pharmacy. So you are the next one. So if this visit service cost me 50 bucks, it would be a good value because I have experience. Okay? Compared to the time I invested in receiving this service, I received a fair return. For example, if I'm a very busy employee and I need to go to the hospital, I don't have enough time. So I expected to spend 1 hour in this visit. So if I spend more, I may not be satisfied with the service. So keep in mind, this patient comes with previous experience. We need to satisfy their experience. Here is an example about patient satisfaction instruments or survey. Let's do this quiz. This service is convenient for me to use. Measure the performance, or measure equity, or measure what? This example. This service is convenient for me to use. Measure the performance, which is the first one. As you can see, performance evaluation. We talk about the service itself, okay? So, it's performance evaluation. The first four, what about this one? The quality of this service exceeded my expectation. Exceeded my expectations. So we measure this confirmation of expectation. Why I'm showing you this? Because we have 12 questions. Every 3 questions measure 1 item. Every 3 questions we measure 1 domain. 3 questions measure 1 thing. Keep in mind, those 3 questions, they are related. The answer should be related. So I'm pleased with this service. This under what?
Satisfaction.
This, I'm pleased with this service. It's related to the effect-based evaluation. Okay? And finally, compared with the time I spent in this service, I received fair return. This is the equity. You need to remember, as a grad student, when you write survey, we may have more than 1 question measure the same thing. Okay? And those are related together. Sometimes we call them scales or indexes. Okay? Keep in mind, more than a question measure 1 thing. And the questions of those, they should be related to each other. We usually call them, we need to do sometimes, we call it Cronbach alpha, which is reliability measure. Those are when the big mistake when we do the survey, we create questions and we distribute questions without measuring the reliability, without measuring the validity. Keep in mind, those published surveys, it's better to use published one, validated one, better than you create your own. Because those are validated, they measure the same things, and they publish. and it's easier to use them than you create your own. Don't create your own unless you need them, because those are already validated as good reliability. Those three questions, they measure the same thing. So how can we promote the patient satisfaction? What should we do as pharmacists to improve patient satisfaction? We need to be knowledgeable. We need to be competent. As a pharmacist, we need always to update our information. Like, for example, if this patient asks you, I'm a pregnant woman and I need medication safe for me, antibiotic safe for me, or analgesic safe for me. You should be knowledgeable. You should have this knowledge. So to convince or to satisfy patients, you need to be polite, you need to be respectful, you need to be cultural sensitive, especially if you live in diversity. Like in the United States, they have so many cultures. Like people comes from all the continent, from Africa, from South Asia, Southeast Asia, from Middle East, from Europe, from South America. So they have so many cultures, and those cultures, they have sensitive issues. We need to be sensitive. Like some cultures, they consider some religions, like for example, Catholics, they consider the contraceptive prohibited in their religion. So they are pro-life. They are against abortion. Their beliefs against abortion. They cannot induce abortion unless it's medically necessary. So we need to be sensitive to this one. Some beliefs, they consider even the immunization is not necessary. Even blood transfusion. Some Christian domains, they consider blood transfusion is prohibited. They have so many Christian domains. Some domains say, even blood transfusion, like when I admitted for the surgery, they asked me, if you need blood transfusion, can we give you blood transfusion? I say, okay. Because some religions, they don't accept blood for certain belief. We need to be sensitive, we need to care, because this culture is different than our culture. We need to be respectful, we need to care about them. We should not laugh about their choices. That's their belief, their culture, okay? We need to be care, we need to be polite. So, let's talk about the survey. How many ways we have to, we can do the survey? Either paper either directly, or send it through the mail. You know, to say they have very efficient mail system, the post office. You just send it put the stamp and send it by mail, okay? And you receive the mail. There is mail and there is electronic form. We usually make the survey through Qualtrics or other system, and we send the survey as link through the email, or just post it on the social media, okay? This is the electronic. And also, we can do the phone survey. I call you, I say, hey, I'm the pharmacist, I'm doing this survey, can you please answer the following questions? I will read the question for the patient, and I record the answers. Finally, we have the face-to-face survey. I have the survey face-to-face, which is, please could you answer these questions, and you tell them verbally and you check the answers. Imagine which one is the most expensive one. Most expensive. Face-to-face, number one. Why face-to-face? Because I need to be there. I need to meet you face-to-face. I need to meet every single participant.
Can't be conducted at the same time for a couple of patients, for example.
Yeah, exactly. You have limited resources. You have limited space. You need to hire more than one interviewer to conduct this interview. Imagine how many hours you have in the day, and how much you should, like in the United States, the pharmacist fees is usually the salary like $60 per hour. Imagine if this pharmacist conducted a survey, how many hours I need to imagine if it's face-to-face. The second one is the phone. It's also time-consuming, but it's less expensive because it doesn't need transportation. Like I can, you live in Kufa, I live in Baghdad, I can call you. I don't have to travel to the Kufa. The other one is the lower expensive one is the mail. The lowest expensive one, the cheapest one is the electronic one, the internet. I don't have to pay stamps, I don't have to pay for the post office, I just post the link on the Facebook. And that's why it's the least expensive one. But everyone has limitations, everyone has advantages. For example, the face-to-face, you will be sure how many, you will have 100%, like for example, you have complete data because you are completing the data with the patients. But if you give them mail or electronic, they may answer the half the survey and they will skip the others, okay? But in the phone interview or in the face-to-face interview, I may have bias because I may lead the respondent. I say, which one do you prefer? If I smile, it's good. If it's not, you know, you are biased because you are leading. What do you think about my pharmacy in Smile One? You are leading the patient about positive response. But if you send them in paper and it's anonymous, it's more fair. So if I need to survey elderly people who don't use social media, which one I need to use? Facebook. They are elderly. They use
Face-to-face.
face-to-face or mail. In the United States, they have mail. They just receive the message in the mail, the letter. Okay? So it's the best one to survey them. And always keep your survey anonymous, without name. So you don't care about confidentiality, about the patient information. Here we have several tips for you to create good survey. Don't use jargon. Don't use technical terms because you are surveying who? You are surveying normal patients. Don't expect those patients. You always assume your patients, they have low education level. Don't assume they are graduate from pharmacy school or nursing school. Always you need to say those are middle school graduates, and you need to talk with them in general terms. Don't use blood anticoagulants, use blood thinner. Don't use non-steroidal anti-inflammatory. You can use painkiller. Imagine those terms. So don't use blood glucose. You need to use blood sugar. So those are general terms. The second advice for you, don't use double barrels. As I say, don't say, is my service cheap and good quality? Don't ask two things in one question. Keep in mind, this is a very common mistake. Are you satisfied with the price and service? This is the double barrel. Leading question. Did you have any problem with my pharmacist? This is leading. I'm leading you to say no problem. But if I ask you, did you have such and such without say problem? Because problem seems something wrong, okay? And I don't want to upset you. Don't use slang. Don't use abbreviation or shorthand. Don't use negative or double negative. You always use positive. Like don't say, you don't visit your father because blah, 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 blah. You need to say, I visit my father a few days a year. Don't say, don't visit them usually. I visit them few times. Use positive. Do you have questions about those terms? So, the next step, you need to put choices. We have statement, we need to put choices, okay? Hopefully this will help you on your survey and answer a little bit of your questions. I know you have so many questions about the survey. That's why for clinical pharmacy department, this is one of the like special lecture about the conducting survey. Likert scale, have you heard about Likert scale? It's usually either 3-point Likert scale, 5-point Likert scale, or 7-point fire scales. For example, this one is 5 points. It's from 1 to 5. Strongly disagree, disagree, neither agree nor disagree, or we call it neutral. Agree, strongly agree. Sometimes we have 7. I prefer either 5 or 3. I prefer 5 or 3 Likert scale because 7 it's very like about very strongly agree. It's too many. You will not have enough response in each group. Okay, you will end up compiling groups. So either use 3 or 5 Likert scale. We have other than Likert scale, like very unlikely to very likely. You start with very unlikely, unlikely, neutral, likely, very unlikely. Yes or no? Open-ended. What do you mean by open-ended?
Can patient express his feeling or
General question, not specific.
I asked my participant in nursing home an open-ended question. I asked him, what do you need from the pharmacist to reduce the number of adverse drug events? So let them talk, let them express. Do you have any experience in adverse drug events? Without choices. This one is good for the interview or for exploratory.
So we highlight something with it.
Yes, because imagine, I always tell my students, if you need to conduct survey, before you conduct the survey, you visit the setting, you visit the hospital, you visit the pharmacies, you visit the hospital first. You need to talk with the physician, pharmacist, patient, nurse. You need to have an idea what's going on there. Because I don't want you to write survey, it's not practical. It's not applicable to this setting. You need to ask them what's the biggest problem you are facing. So put this note. So you need to, if they say warfarin is a troublemaker, you need to ask about the warfarin. Don't ask about paracetamol, which is not commonly used, or psychotropic, which is not commonly used. You need to ask them, you need to talk with them. Ask them open-ended question. You will have information before you conduct your survey, because your survey will not be valid unless you go to the field. Ask the participant, ask the nurse, ask the physician, ask the pharmacist, what's going on here? What's going on about psoriasis? You need to because you are not expert in psoriasis, you are just a new student in this field. When I entered the nursing home, I didn't have any experience. I went five times, 5 days with a nursing home consultant pharmacist. I spent 5 days before I started thinking about the survey. I went to them, I spent whole day with the consultant pharmacist and asked the nurse, I asked the director of nursing, I asked the certified. I try to understand what's going on. We don't have nursing home in Iraq. I don't know how this system is going on here. So you need to talk with the expert before you create your survey. Because if you create survey without knowledge, without good background, you will end up with maybe not efficient instruments. Multiple choice, we always have, it's easier to give choice. Rank or order. So these are the tips. You need to put your survey in elegant way. Always put introduction. You always put something to put this, my survey. You need to introduce the survey at the beginning. You say, I'm a grad student in pharmacy school. I'm a master student in pharmacy. I'm conducted this survey to measure the adherence of patients to diabetic medications. So please help us to answer these questions from your experience. Your information will be anonymous, will be confidential, will not share your information with other people. Will only use for research purposes. You need to tell them what's going on, and if you have questions, please email me. Put your phone number or email. You need to give this letter at the beginning, so the patients or the participant will understand what these questions are about. Okay, don't suggest, as some of you just send me the introduction without even the title. yesterday. This introduction for what? I need the title. So please put the title. You need to put some introduction. And you need to be elegant. Put choices. Put columns. Don't make it mess. Don't make it hard to read. Don't make it very long questions because they don't have time. Don't put very long questions or very long list of survey. Imagine they only have 5-10 minutes to answer your survey. Make it as shorter as you can, very elegant, very appealing. And you always put like logo of University of Baghdad, for example, or your hospital. You need to put trusted setting because I need to calm the patient. This is very trusted university. This is not coming from outsider or somewhere else. You need to introduce yourself. I'm a master student in Kufa University, and I'm doing this research about this disease. Please help me with your experience. And this will be short survey, will not take more than 5 minutes. So the participant will be, please try to answer all the questions and feel free to skip any questions. It's optional anonymous survey. So you need to put and the institutional review board in the University of Iowa, they always must put this letter at the beginning. So it's required by the university. This is just an example of how helpful or convenient did you find we reviewed your medication over telephone? Not all, most likely. Look, higher is better. Please try inclusiveness of, look to this survey. It's elegant and it's easy to be answered. And if you are a participant and you get this survey, it's easy to check. And it's very clear, excellent, very good, good, fair, poor. Look. So don't put those heavy worded or very long or not clear. Always to be elegant survey so we can measure this. In summary, we have two models today. Structure, process, outcome model. We have the second model, which is ECHO model. E for economic, C for clinical, H for humanistic outcome. Patient satisfaction is a key quality because if this patient is satisfied, so we did well. It's reflect to our service. We need always to measure patient satisfactions and we need always to use the right tool. You need to learn how to conduct patient satisfaction survey. Okay? Do you have questions about today?
There is maybe a mistakes or difficulty in translation of the survey to the mother language of the population.
It's a good question. You need always to what we call it translation and back translations. Like you need to translate it in Arabic to Arabic. And when you translate it to Arabic, you should able to translate it back from the Arabic sentence to the English and should give the same meaning. And I prefer more than one translators, like you translated, and should be other couple, you send it to two other professional in the field. Send it to expert in the field, so we can review to you and send you some feedback. Because if you translate it, please translate it to formal Arabic. Don't translate it to Iraqi slang. Yeah, it's a recording. So don't translate it to slang. Translate to formal Arabic because you don't make it only because, for example, in health literacy, I conducted a health literacy project with collaboration with Dr. Mohammed Al-Rikabi in Kufa in 2014. We published this in Research, Social and Administrative Pharmacy, which is one of American journal. What we did, I translated, I sent it to him to give me the feedback. After we translated formal Arabic, now, like since then, I have like 40 requests from all the Arabic countries. They required my Arabic items for the health literacy. We translated the short, the Astofla, and we translated the cells and new vital signs. All these tests, we translated to formal Arabic. So I send it to all Arabic countries to use it because it's informal Arabic. So don't translate it to slang, to Iraq slang. And you always need to review it, more than one reviewers, and you need to translate it and translate it. But it's a really good question, thank you. Do you have other questions for today, lectures? Thank you so much. We'll take a break for today. Will you turn it off? Thank you.